Well. Thank you so much for joining this particular video, and I'm very happy that those who are with me uh, are encouraged to help us in this particular video. So, guys, mm, welcome back. Just want to uh, bring some teachings which can help us uh, in this particular channel. Now, welcome back, my good people, and I just want to be brief in terms of a recurrent vaginal candidiasis, which has been affecting most of the ladies. And in this particular topic, we are going to define what candidiasis is, maybe causative organisms, types of candidas, symptoms, and eventually treatment. And I want you to be very keen because this is a very important topic that affects most of our ladies. So, guys, I want you to be keen about this and share this live to very many people because your significant support is really key in terms of this particular video. Now, straight to it, without wasting time. Most of this has been reported to us that one person presenting with recurrent episodes of vaginal candidiasis, which is defined as 4 or more episodes of vaginal candidiasis or vulvovaginal candidiasis within an year. So it's a common problem in women of a reproductive age. So I want to start by saying that the most important and significant of all is the organism called Candida albicans, which normally account for 80 to 90% of the cases of vaginal candidiasis. So, non-albicans candidiasis species most likely in recurrent or resistant infections normally occur in ladies, and this is supported by what the organisms we call the Candida glabrata, tropicalis, crucei, and parapilosis. And most of these are resistant to drugs. Now, anyone listening to me, if you are a lady who has intense vaginal itching or even burning, which is accompanied sometimes with thick white cottage cheese like discharge, and sometimes you feel there's redness and swelling of the vulva, and even pain during urination or intercourse, and even cracks or fissures in vulva in severe cases, then this is the best place for you. Now, there is a reason why there's a recurrence of this particular problem, ranging from various factors that I'm going to list. Now, there's a video I made why ladies should be drinking yogurt, because we want you to get those probiotics. When you are using antibiotics, you are at high risk of even developing a candidiasis. Just know that candida sometimes is a normal flora in the vagina. It just stays there. But when the pH of the vagina goes down to less than 4.5, now the disruption takes place, and now the candida starts to overgrow because of the pH has gone down. So antibiotics used normally disrupt this normal range of vaginal flora, which may cause this particular candida to be more recurrent to you. So we advise ladies, you continue drinking yogurt and you check how you take your antibiotics. Pregnancy is also a risk factor that may bring recurrent vaginal candidiasis, uncontrolled diabetes mellitus, uh, that is when your sugars are high, you may have this recurrent vaginal candidiasis. High estrogen levels, which may be due to hormonal contraceptives that you may be using, can contribute to this recurrent vaginal candidiasis. High steroid uh, usage. Steroid normally reduces immunity, and if you use it, sometimes you may be immunosuppressed when you constantly use it, or when you are uh, HIV positive and maybe you have AIDS. You can be constantly having a recurrent vaginal candidiasis. Now, this is normally common in the youths. Tight or non-breathable clothing. We want you to wear non-breathable clothing, and these are very very important because when you put on tight clothing, there's possibilities of moisture forming, and when there's moisture, and this normally trap bacteria and candidas, and this one contribute uh, to this particular topic that we are talking about now. So make sure that there is no tight clothings. Their clothings are breathable, particularly the underpants and underwears, so that you do not develop this frequent vaginal candidiasis. Now, there's something we call dodging. Dodging. This is now you introduce your hand or any other object to the vaginal area. And when you do this, you disrupt the normal vaginal flora, and this may contribute to a big role of a Candida albicans. So, ladies, we are advising you not to dodge your vaginal area, and also we are advising you to stop using high sugar diet, because this is a major threat to vaginal candidiasis. Just to remind you again, is that when you have intense itching or burning sensation in your vaginal area, when you have a thick white coated cheese-like discharge, pain during urination or intercourse, when there's a redness and swelling of the vulva, and even crack or fissures in severe cases, then these are typical symptoms of vaginal candidiasis, which may recur due to those following factors that I've mentioned, that I'm also going to list again, like antibiotics use, pregnancy, diabetes mellitus, use of hormonal contraceptives, high estrogen levels. This can be due to estrogen therapy, or even the drugs that you take to regulate your hormones. Immunosuppression like HIV, AIDS, use of steroids play an important role. Frequent douching, this is now washing your vagina with different kind of soaps. Some ladies normally do this to make the vagina smell nice. Vagina should not first smell like a rose flower or even a perfume. Vagina has a distinct smell, even like the eyes. You don't normally wash your eyes with detergents or anything. Vagina is self-cleansing. So do not wash or do not dodge. Do not insert anything into your vaginal area. And ladies, avoid sugars as much as possible. And always screen for diabetes. Avoid unnecessary antibiotics. Earlier I said that for those who are joining, that for recurrent vaginal candidiasis to occur, you might have been using excess antibiotics, particularly most ladies who normally just go to the hospital that they are treating UTI without knowing what is happening. Now, when you go to the hospital and an investigation has been done, that is urinalysis, and maybe your clinician or your nurse or your doctor has told you that you have a urinary tract infection. of course, they are going to subject you to some drugs, that antibiotics that you are going to use. Kindly, please, let them add probiotics. Probiotics are very many, like Cosflora, or if you do not have access to any probiotics, just go buy yogurt. Because those lactobacillus, those probiotics, there are billions of them. We normally get in drinking yogurt. So that's why, if you've not watched that video I made about the reasons why ladies should drink yogurt, please kindly do so and find time to watch that particular video. So probiotics may help some patient, and it's very very necessary to do that. So management of vaginal candidiasis is case by case, and majorly we use azole drugs, clotrimazole, ketoconazole, miconazole, either topical or orals, or even sometimes we don't use injection at this particular level. So fluconazole oral 150 milligrams start is enough for you, a single dose. Or you can use topical azole, clotrimazole, miconazole, or for 3 to 7 days. That is for acute infection. For acute infection, a single dose of fluconazole is enough. But recurrent candidiasis, um, there's a maintenance and induction that we should be able to know. The one that is coming and going back. After every 2 weeks you have candida. After every 2 weeks you have candida. So for an induction, for recurrent candidiasis, you need an induction dose of fluconazole, that 150 milligrams orally every third day for 3 doses. That is, day 1, you take 1 tablet, day 4, and day 7. If it is recurrent, remember the topic of today is recurrent vaginal candidiasis. We are not talking about acute infection, maybe candida for the first time. We are talking about candidiasis that is coming and going, coming and going, coming and going. And this is what is affecting most of ladies. And that's why I brought this topic in terms of live, that when you have acute infection, candida for the first time, usihangaike. Fluconazole 150 milligrams, meza tu tembe hiyo moja, hiyo imetosha kuclear. Or kuna zingine za kupaka. If you are understanding Kiswahili, there are some topical azoles like clotrimazole, miconazole, which you use for 3 to 7 days, and that is enough. Now, for recurrent, the topic of today, for recurrent vaginal candidiasis, we have what we call induction treatment and maintenance, because this thing has been affecting you. So you need a fluconazole 150 milligram orally every third day for 3 doses, meaning day 1 you take 150 milligrams, day 4 and day 7. Then you do a maintenance dose. This is now to clear it fully. A maintenance dose of fluconazole 150 milligrams once weekly for 6 months. I'm talking to those people mwenye huwa wanafikiria, they normally think they have a UTI, but it is recurrent vaginal candidiasis. Now, when you do this and the problem is still arising, we have what we call culture and sensitivity. Don't go back and do urinalysis. It will not help. After you've used fluconazole 150 milligrams once weekly for 6 months and the problem is still persisting, you should do what we call culture and sensitivity. So culture and sensitivity will help us to rule out the resistant strains of non-albicans strains, the one that I was talking about, tropicalis glabrata, those ones. So if you do that, then there is a special drug that you use. Sometimes when somebody has recurrent vaginal candidiasis, he has used clotrimazole, fluconazole, there's no change, they just rush to this minus doing culture and sensitivity. Now, boric acid is the drug of choice. Boric acid, which you take 600 milligrams vaginally daily 14 days. Hii si ya kumeza, inakuingiza chini, milligrams vaginally. I'm repeating, topical boric acid 600 milligrams vaginal daily for 14 days. And this one will help to clear those tropicalis and glabrata I was talking about. Remember, when we go back to candida types of Candida species. I talked about albicans, glabrata, tropicalis, crucei, and parapsilosis. And these are the others, that is glabrata, tropicalis, crucei, and parapsilosis, are really resistant to azole drugs. Only Candida albicans are really sensitive to azole drugs. That one, the one you insert for, maybe you can be given one to insert for 6 days, or even two to insert for 3 days, depending on the milligrams your clinician, your nurse, or your doctor is giving you. So I'm talking to those who have recurrent candidiasis, and they have been experiencing intense vaginal itching or burning. They have been experiencing thick white cottage cheese like discharge. They have been experiencing redness, swelling of the vulva, pain during urination or intercourse, and cracks or fissures or vulva of the skin. So, if you love this channel, kindly give us a thumbs up, and remember, always keep us going by liking this particular channel. Click the notification, return, subscribe, turn it on for more videos that I will post. Signing out, this is your Dr. Pamli. Let's meet in another live.